This is what a bunion and hammer toe look like before surgery and immediately after surgery. And here's what it looks like on the inside. That's a lot going on in there. So here's what a bunion is. It's not extra bone growth. It's not a tumor, it's the spreading of the bones due to pressure over the years. So as the bunion comes over, the hammer toes start to develop because there's no room for the toes. See, normally they'd be straight where the big toe is, so this is really the driving factor. So lots of different types of hammer toes can occur, but the toes basically contract and don't straighten the way you want them to look. So there's different surgeries. The more severe the bunion, as you can see right here, the bigger the procedure, as you can see right here. So small procedure, big procedure. Big bunion, little bunion. So smaller procedure here, bigger here. For the hammer toe, same thing. You can do small procedures. Simply pushing with a needle and lengthening the tendon could correct the hammer toe. In other cases, implants are needed, essentially as dowels. So you can see different implants, lots of different types of surgery, depending on what you need. In this case, sometimes lengthening the tendon here would be enough, but in this case, you have to remove the actual joint and make it heal straight together with an implant. So lots of different cases. In the toughest cases like this, you might even do a plate. You might use a plate here, and then this is actually many surgeries. A plate here, a hammer toe correction here, tendon lengthenings here, a bone fragment cut out here, and a pin put in for a bunionette to the fifth toe right here. So as you can see right here, 1, 2, 3, 4, and 5 right there. 1, 2, 3, 4, and 5 right there. So a lot going on. You're going to have to keep this dry while you're showering for a couple weeks. And in some cases, some doctors like to use casts. We personally like to use boots and surgical shoes so you're not stuck in this situation where you can't dry for many weeks. So boots and surgical shoes are the way to go for our purposes. The incision lines can be very minimal and these heal very quickly. So this is 1 week out. It looks excellent. Few weeks to a few months out, that looks amazing. This is the pre-op, the post-op, obviously. That's what it looks like during the recovery. That's what it looks like immediately after. That's what your dressings look like. Incision lines can be right here. And then within about 10 days in some cases, you're back in a healthy, supportive shoe. So a boot between 2 to 6 weeks. As you're wearing a boot, you might have to protect it, but there's ways around this if you do need to. Pain medication, same thing. 1 to 2 weeks of pain medication, and then you're back in shoes within most of the time around 10 days. So come visit us at Michigan Foot Doctors. We're in Ann Arbor, Brighton, Howell, and Chelsea. We have some amazingly trained doctors with the highest surgical training. We are the foot experts in the area. We're national and Michigan level speakers, and we're involved at the hospital and residency programs. So come see us and come get your foot and ankle taken care of. If this helped you at all, please visit our website where you can get even more information. And if this video did help, give it a like and a share, and we'll see you soon. This is MichiganFootDoctors.com.